A couple of Toronto's safe injection or overdose prevention sites have come forward with a new report outlining the work they have done since losing funding from the province last year. It's all to make a case for new money. However, it seems to be falling on deaf ears at Queen's Park.
I went many years using crack and then was introduced to the needle, which has taken a hold of my life today.
Angie Austin says she's been an addict for 25 years, been close to death after shooting up in stairwells, and owes her life to safe injection sites.
You play Russian roulette every time you put a needle in your arm. It's scary. If it wasn't for these people, like I said, I don't think I'd be alive today.
A new report claims success at the Street Health and St. Stephen's overdose prevention sites in Toronto, despite losing funding from the provincial government. But they say it can't continue without support.
It's critical that these services are funded by the provincial government. We know they save lives. We're in the midst of a crisis, and it's not the time to be looking solely to the goodwill of the community.
According to the study, nearly 5,500 visits at the two locations have led to a monthly average of 90 referrals for further health care and addiction treatment.
These sites are serving an absolutely vital function in the community right now in providing a low barrier entry point to the health and social service system for a group of people who are very vulnerable.
The call for more funding today was met with information from a 2018 review by the province. In a statement, Health Minister Christine Elliott's office said Ontario allocated up to $31.3 million, and usage increased for the 16 approved CTS sites when compared to the same sites operating under the old model.
In our country, we lose a person, one life, every 2 hours to opioid overdose. And this I've characterized as the defining health crisis of our time.
The province determined Street Health was too close to other sites in Toronto, and St. Stephen's didn't meet community engagement requirements. Tell that to Angie, who considers these sites a godsend for helping her through some pretty dark times.
When you walk in there, they make you feel, they don't make you feel like you're an outcast, or they're just meeting you. They welcome you with open arms.
The province says that both the Regent Park and South Riverdale sites are actually close enough to this location that there's no need to fund Street Health. Street Health and St. Stephen's Community House both received exemptions last year to continue to operate. We do know that those exemptions will be up as of next week.